Shows EMS calls in Sun Prairie are up by more than 75% since 2018, and firefighter responses tripled in the last decade. WMTV's Nicole Herzog sat down with Sun Prairie's fire chief to find out how they plan to keep up with the increased calls and how it could impact your wallet.
When you call for an ambulance, it's expected that first responders will arrive within minutes.
We've had some bad incidents here in Sun Prairie.
Sun Prairie Fire Chief Christopher Garrison says his staff is working hard to do just that, but not without some difficulty.
With the growth that we have, it's hard to keep up public safety. I'm talking police, fire, and EMS.
A new report from the Wisconsin Policy Forum shows the city of Sun Prairie is one of the fastest growing cities in the state.
Because of that growth, both in Sun Prairie and in at least some of the surrounding areas and communities, that has put greater than typical pressure on fire and EMS.
Researchers say covering such a large area is part of the challenge.
If someone's having a heart attack, they need to be able to get to any part of that area within minutes, including these rural areas, and yet at the same time, the vast majority of their calls are only happening in the city of Sun Prairie.
The forum found total fire calls are expected to rise by more than 20% by 2030, and EMS calls are expected to grow by over 40%.
We're doing well at keeping up, but the big issue is you have to look towards the future. And with this growth, if we stay as we are right now, we are not going to be able to handle that growth.
One of the recommendations, Garrison says, the city is heavily considering going to referendum. Garrison says he knows it isn't what people want to hear, but believes more money is necessary to add more staff and keep up.
I'm a taxpayer. I live here in Sun Prairie. I have some of the same concerns that they do, but we have to keep up with the growth. We have to be mindful of what we're doing.
Now, the Wisconsin Policy Forum also recommended that Sun Prairie consider implementing fees for facilities that use emergency crews to lift fallen residents and fines for repeated false fire alarms to keep up with costs.